You're listening to Healthy House Calls with Angel, episode number 1. Hello, welcome to Healthy House Calls with Angel. I am your host, Angel Shannon, giving you tips, tools, and holistic strategies to live a healthier life by intentional design. Join me as we explore the landscape of lifestyle medicine, offering practical tips that help you eat, sleep, move, and live better, and help you become fit and functional for life. Thank you for tuning in. Enjoy the show. Hello. Welcome to the very first full episode of Healthy House Calls with Angel, and welcome to the Fit and Functional for Life community. I'm Angel Shannon, your host, and I would welcome you to a community that believes that good health is so much more than just a normal physical and the weight on a scale. Good health is also the sense of harmony, balance, peace, purpose, and fulfillment we feel in our lives. Now, if you're brand new to our community, here's what I'd like you to know. We're a community that believes first and foremost that health is the first wealth. And because of that, we declare our physical, mental, and spiritual well-being to be our single most important priority. We value knowledge, wisdom, and most importantly, personal transformation. We take our health into our own hands by being informed and empowered. We take action and we hold ourselves accountable. We prioritize rest, movement, mindfulness, optimal nutrition, spiritual growth, and meaningful work that aligns with our life's purpose. In a nutshell, we're a community that desires to be fit and functional, not just for a day, not just for an event, but fit and functional for life. So I decided, since so many people come to me with horror stories about healthcare experiences that they've had, friends and family members included, and because I myself have had horror experiences as well, even though I'm a healthcare provider, I figured the best thing to do is to kick off this podcast addressing something that I think is very important, like really, really important. And that is how to be a good patient. So, since nothing provides a good explanation of what a good patient is, like a good practical story, I want to share with you a real story from my clinical practice. Now, I want you to know that all names are fictionalized. This is not an exact person by name, but this is a true story from clinical practice. So prior to the start of COVID, I had a patient call my office desperate for an appointment. She'd been referred to me by a local colleague who was unable to take her on as a new patient. And let's just call the person Mary, okay? So Mary was really anxious because she had been having some odd symptoms that included numbness and burning and tingling in her hands and feet. So bad that she was having difficulty walking and was having trouble holding a pen for long enough to write because the burning in her fingertips was so bad. Now, my schedule was really full, and when my administrative assistant told her that I wasn't able to book an appointment, Mary got really upset and pleaded to, come after hours or anything that could be done. And we really just couldn't accommodate it because the schedule was so full. So she understood and she said, well, if there are any cancellations, I can come at any time. Please, can you put me on a waiting list? So we did that. And sure enough, as luck would have it, we had a rescheduled appointment a week later, and that opened up an opportunity for Mary to get her first appointment with me. So Mary came to the office right away when we called and said that we had this afternoon appointment, and she had all of her health records from her prior healthcare provider. But by now, this numbness and tingling and burning in her fingertips and in her feet was keeping her up all night. And she was so terrified. And she's wondering, what's going on? Am I having a stroke? What's going on here? So she comes to the appointment. And because I've been practicing for a number of years now, it didn't take much to figure out that this was a neuropathy, which is essentially the pins and needles type of pain, weakness, and numbness that's usually associated with nerve damage in the hands and feet. A common cause of neuropathy is diabetes, but it can also come from different types of infections, injuries, sometimes from exposure to environmental toxins, sometimes as a side effect of different medications, and even sometimes due to nutritional deficiencies. So it's really important to get a full assessment of what's happening to make a proper diagnosis. And keeping that in the back of my mind, I did a full head to toe physical and ordered some blood work. And then I asked Mary if I could take a look at the health records that she'd brought with her. Now, to her credit, Mary was really, really organized. She had copies of her gynecological records, her prior physicals. She had copies of x-rays, of an MRI that she had had some time ago for back pain. And she had 3 pages worth of lab results that she'd had done at a physical 2 years ago, 2 years prior to this appointment. And here's where it got interesting. So 2 years ago at Mary's physical, she had a blood sugar result of 128 and a cholesterol level of 272, both of which are abnormal results. They are elevated, they're high, and pointed towards what I was reasonably sure the diagnosis was going to be, which is diabetes. Now, when I asked Mary what she had done about these abnormal test results that she had had 2 years ago, she said that the healthcare provider had called her and gave her the results and told her to watch the sugar and to try to lose some weight. And that was it. I asked Mary if she'd been given an actual diagnosis, and Mary said no, she hadn't. She said she was just told to watch the sugar and try to lose some weight and to come back, make sure she came back for her annual physicals and screenings and whatnot. Well, life got busy, and Mary had missed her physical the following year. And of course, now here she was in my office. So let's unpack what's going on here. There's a routine physical. There are some abnormal lab results that came back after the physical. The healthcare provider definitely did what was right, informing her of the abnormal results, and there was some advice about what to do. The advice was to watch the sugar and lose some weight. So here's what I want to ask you. What does watch the sugar actually mean? What kind of sugar should Mary be watching? Where should she be looking for this sugar? How will Mary know exactly how much sugar she should and shouldn't be having? Let's also talk about the lose some weight. So what is some weight? How much is that exactly? And why does Mary need to lose weight? See, there's a difference between losing weight to fit into a wedding dress and losing weight to, go to an event. And then there's losing weight to reverse or stave off a life-altering disease. And that brings me to an important point. What is Mary's actual diagnosis? What is Mary dealing with here, and why is that important? It's important because you can't manage what you can't name. So I sent Mary for some new, fresh labs, and as you can expect, her results were actually worse than the labs that she had had from the physical 2 years ago. Turns out she has now what's known as metabolic syndrome, which is a cluster of conditions that can occur together. These conditions include increased blood pressure, high blood sugar, excess body fat around the waist, and an abnormal cholesterol or elevated triglyceride levels. The problem with metabolic syndrome is that each of these conditions independently and collectively increase the risk of heart disease, stroke, and type 2 diabetes. So let's get back to our unpacking and let's talk about what went right and what went wrong. Let's talk about the wrong first. What went wrong is that Mary had no answers to any of those questions that I mentioned earlier. And those questions were, what does watch the sugar actually mean? What kind of sugar should Mary be watching? Where should she be looking for this sugar? And just how would Mary know exactly how much sugar she should and shouldn't be having? Sure, the healthcare provider advised her to lose weight, but Mary didn't know how. Did she get connected with any resources or referrals to learn the who, what, why, and how? Now, here's what went right. Let's talk about what's really right in this equation is that Mary, to her credit, came to her appointment with me prepared with two things. One, she had records of all her previous medical care organized and labeled with highlighted dates, the names of the healthcare practitioners that she'd seen previously, the results of all of her tests, and she had all of these things in chronological order. Number two, about what's right is Mary had a clear understanding of her symptoms. She was able to tell me exactly what was going wrong. And in clinical practice, we have an acronym called OLD CART, which means onset, location, duration, contributing factors, alleviating factors, relief, and treatment, right? So we use this little acronym to get to our diagnosis. And all of this information is what your healthcare provider uses to establish something called context, which helps us establish the diagnosis. So think about it. A headache that had an onset of 1 day ago is a lot different than a headache that someone's been having every single day for the past month or the past 6 months. Location. Pain that's in the middle of your chest is a whole lot different than pain that is above your belly button. Pain that lasts for 1 second is a lot different than crushing pain that's lasting for 5 minutes, right? So this is the kind of information that helps your healthcare provider help you. Okay, so when I saw Mary at her physical, she had all of those details. This starts at nighttime. It keeps me from walking. It starts at this time. It ends at that time. It lasts this long. Okay, I've been taking Tylenol or Motrin. It hasn't helped. She had all of these details to provide to me at that physical. And she had taken records. She had taken notes, and she had all of that written down for the appointment. And lastly, what Mary also had in her favor was an important question, which is Mary also knew her family history. In this pile of documents that she had brought in, she had her maternal and paternal grandparents listed. She knew that they had died from heart disease. She knew that her mother had died from diabetes and complications of a stroke. So naturally, Mary was really worried, and she was coming to me because she wanted this diagnosis. She wanted relief from this pain, but she also wanted to learn what to do about this, what she could do. She didn't let the fear of the unknown keep her from being empowered to come in and figure out what was happening. The unfortunate part is that Mary had now lost 3 years of time from making important lifestyle changes that could have kept this condition from getting worse, as the lab results clearly revealed. So let me share with you that lifestyle medicine is a science-based approach to preventing, treating, and even reversing diseases by replacing unhealthy behaviors with positive ones, such as eating healthfully, regular physical activity, managing emotional stress, avoiding risky substances like drugs and alcohol, getting adequate sleep, and having positive social interactions and a strong support system for mental health. And that's what we teach at Siva Health and in the Fit and Functional for Life community. People often ask me if lifestyle medicine is different from conventional medicine and regular doctor visits, and the answer to that is no, not at all. Almost all clinical practice guidelines for the top chronic diseases support lifestyle medicine as the first line of treatment. And the American College of Lifestyle Medicine suggests that we clinicians have to start putting as much focus on lifestyle medicine as we do on medications and procedures. So, for example, let's take a look at the American Heart Association and the American Cardiology clinical guidelines for high blood pressure. And if you were to pull up that guideline on the internet, there's a table that lists a full set of lifestyle modifications that should be recommended. Reduction in salt, healthy diet, healthy drinks, moderate alcohol consumption, weight reduction, smoking cessation, and regular physical activity. Here's what else they mention in their guidelines. And I'm talking about the American Heart Association and the American Cardiology Association. Reduction of stress and mindfulness. Reduction of exposure to air pollution and cold temperature. And though it isn't listed here, what I would even add to the clinical guideline would be adequate sleep, since there are hundreds, if not thousands, of studies on the role of sleep in heart health and the implications of sleep apnea on heart health and so on. And I know my colleagues in sleep medicine and pulmonary medicine would support that. So let me just say, here is the American Heart Association and American Cardiology Association guidelines just for hypertension. And here's a whole list of lifestyle modifications that they recommend as part of treatment that I just read off. Altogether, there are 9 different interventions that are clinically recommended for managing high blood pressure that have nothing to do with medication at all. Let's take a look at the clinical guidelines on elevated blood sugar. And for that, we can just turn to the American Association of Clinical Endocrinology, since diabetes is an endocrine disorder. I want to read to you exactly from a couple of these guidelines. Early intervention to prevent progression to type 2 diabetes in people with prediabetes and or abnormal fat around the middle adiposity with insulin resistance is important because later intervention to manage type 2 diabetes and its complications is generally more expensive and carries greater risks. So what are they saying in this guideline? They're saying, get in there early. Get in there early and make some changes, because waiting until later in the disease, later intervention, is more complicated, more expensive, and carries greater risks. Here's another direct quote from the American Association of Clinical Endocrinology. Lifestyle optimization is essential for all patients with diabetes. Lifestyle optimization is multifaceted, ongoing, and should engage the entire diabetes team. However, such efforts should not delay needed pharmacotherapy in higher risk individuals, which can be initiated and continued simultaneously and adjusted based on patient response to lifestyle effort. The need for concurrent medical therapy should not be interpreted as a failure of lifestyle management, but as an adjunctive intervention. What is this saying? It's saying, hey, listen, lifestyle optimization should be a focus, always adjusted by the entire diabetes team. Don't let lifestyle modifications be your only way of treating this, and certainly don't delay medications if they're needed, but think of this as a whole person approach to managing this early diabetes. Let me give you another one. Lifestyle therapy begins with motivational interviewing techniques, nutritional counseling, and education. All patients should strive to attain and maintain an optimal weight through a primarily plant-based meal plan, high in polyunsaturated and monounsaturated fatty acids, with limited intake of saturated fatty acids and avoidance of trans fats. The clinician, a registered dietitian, or a nutritionist should discuss recommendations in plain language at the initial visit and at least briefly with each follow-up visit. Discussion should focus on foods that promote health, including information on specific foods, meal planning, grocery shopping, and dining out strategies. Patients should be instructed on proper interpretation of nutrition facts labels on packaged foods. And guess what? Here's the line I love the most in this guideline. Direct quote, clinicians should be sensitive to patients' ethnic and cultural backgrounds and their associated food preferences. So what is this, my friends? All of this is lifestyle medicine. And this is the missing link in Mary's scenario. So here's what I want you to know. I want you, from this podcast forward, from this episode forward, I want you to craft a picture in your mind of what it means to be a good patient. And here's the definition that we use in the Fit and Functional for Life community and in our health coaching program. A good patient is a patient who is empowered to be an advocate for themselves at all times. Full stop. Period. Does a good patient know everything? Absolutely not. Does a good patient always have the answers? Absolutely not. But a good patient can and should always be empowered to be an advocate for themselves. Being an advocate does not mean knowing everything. It simply means operating from your own best interests, identifying your blind spots, seeking out reliable information that you need, and more than that, having information that you can apply, and then applying it and refining your process over and over and over again. So here are some tools and some takeaways for being a good or becoming a good patient. Number one, always own your health narrative through your health records. Do you know that your health records belong to you? They belong to you at every appointment, whether it be routine blood work, a CAT scan, an MRI. You have the right to ask for copies of your health record, your tests. And when you get those copies, you have the option to store them any way, any place, anywhere that you'd like to that is secure. For me, that's as simple as a 3-ring binder from Walmart or, the local dollar store, with dividers that separate my physicals from my gynecological appointments, from the dentist, from the x-rays. In other words, I have my whole health narrative and health history in one place so that I can draw from that and I can be empowered with the facts about my health history. Not the things that I think, not what I'm guessing, not what I'm trying to remember, but everything in one place so that I'm ready to go. Number 2, bring your healthcare records to every appointment. No matter whether you store them in a binder or in a cloud, wherever you decide is safe and secure for you, have those health records ready to go for every appointment. Because here's the thing, your healthcare provider can only give you their recommendations based upon the information that they have available to them when they are having your appointment with you. If you had a recent appointment at a heart doctor, then it's important for your primary care provider to know exactly what the heart doctor found and what the person's recommendation was. Now, you can try to relay what the heart doctor said, but what happens if you miss an important detail? Now your primary care provider, the person who's seeing you now, is going to be making a decision based on misinformation that you've provided. So information is only useful to the extent that it can be applied and to the extent that it is accurate. So you want to be able to provide accurate information to your healthcare provider, no matter who that person is, at any given time. That's number 2. Number 3, make lifestyle changes part of your treatment plan for every single condition that you are concerned about. Whenever you're given a condition that starts with pre-diabetes or borderline, know that that is the stage when you have the greatest chance of influencing your condition for the better. Pre-hypertension, pre-diabetes, precancerous, borderline hypertension, borderline diabetes, same thing. It simply means that this is the stage when you want to ask your healthcare provider two specific questions. A, what lifestyle interventions can I take right now to change this condition before it is no longer okay? And B, the second question, who should I add to my team, to our team, to help me do that? You remember the guideline that I just read a few minutes ago about a registered dietitian or a nutritionist. This is a person who can be added to the team. Okay, so we're asking, who should I add to my team to help me make these interventions? And here's where you want referrals. Should I see a nutritionist? Should I see a registered dietitian? Should I see a specialist to get a second set of eyes on what these findings are in my lab results? There's no harm in asking that question, because guess what? 4 eyes are better than 2. 6 eyes are better than 4. 8 eyes are better than 6. When you have the need to have other eyes on something, or you need support, or you need that second opinion, okay? So this moment forward, make lifestyle changes. And the question about lifestyle changes, part of your treatment plan. If you're seeing your dentist and your dentist says, hey, you've got gingivitis, swollen gums, what lifestyle interventions do I need to make? What lifestyle changes do I need to make to get a hold of this? Okay? That brings me to number 4. Ask for the guidelines. This is public information. This isn't anything that, you have to be in some secret community to have access to. Okay. Some of them, many of them are written in language that is specific to clinicians, doctors and nurse practitioners and physicians' assistants and nutritionists and whatnot. But there are parts of the guidelines that are readily accessible to the healthcare consumer, written in what we call patient-friendly language. Okay, so you want to be asking your healthcare provider what the guidelines are. Are there guidelines that pertain to lifestyle medicine that I can take advantage of to manage this condition? Okay, every healthcare professional knows what that means and can readily point you in the direction of patient-friendly guidelines with pages and pages of research to back it up. And if you're a visual learner and you prefer audio or video, then just ask for that too. There are so many, there are thousands of organizations like the American Heart Association, the American Diabetes Association. These organizations work really, really hard at making infographics and patient-friendly handouts for all different kinds of learners. Things that are on YouTube, they're published on YouTube by their organizations that have been properly vetted to be factual. I'm not talking about anything that's in, out there in the just social media. I'm talking about like well-vetted guidelines and recommendations that have been worked on very hard by these organizations and fact-checked and are for public consumption. So you want to be tapping into those guidelines and you want to be asking for that from your healthcare provider. Okay? And the last piece of advice I want to give for becoming a good patient is willingness. Willingness and an open mind. A mindset that says, I want to learn. I want to grow. I'm not going to get this right 100% of the time, but I'm going to try. I'm going to put my best foot forward to try to make a positive change in my life. I want to read a quote from a book that I read some time ago about effort and about intention. And I want to share this with you because I think this is really important. The determination as to how one wishes to proceed on any path is one best made not from the linear considerations of the mind, but rather from one's experience of the process itself. It is irrelevant that certain methods have yielded results for untold thousands of years if that is not your own personal experience of it. Do not be inclined to feel that you are inadequate in your practice of any given technique or discipline if after a given amount of time of your experience is not rewarding. It may well be that what is missing is not the way that the effort is done, but rather the energy you have brought to the doing. So my friends, I want to say, bring the energy of intention. Bring the energy of desire to learn, to grow, to see this as a lifelong set of new habits, a lifelong lifestyle. And that's why it's called lifestyle medicine, because it isn't about quick fixes and instant solutions, but it's about developing new habits, new practices, new language for a new journey towards becoming what I call fit and functional for life. So I hope this podcast has been helpful for you. I hope that we have created a more expansive understanding of what lifestyle medicine is, and more importantly, how you can be empowered to be a good patient, with the knowing that being a good patient is just about being an advocate for yourself at all times. Keep in mind that none of what is discussed in this podcast today is meant to be diagnostic, medical, or legal advice, but just education for you to become fit and functional for life. Last but certainly not least, I want to thank you for tuning into today's episode. And I don't want you to miss one detail of what's going on in the Fit and Functional for Life community. In fact, I want you to join this community. So go ahead and hop on over to the show notes. Get signed up for my free newsletter, Healthy House Calls with Angel, so that you can stay abreast of the latest podcast episodes when they drop, new courses, and all the good stuff about lifestyle medicine, integrative health, functional nutrition, how to eat, sleep, move, and live better. All the tips, tools, and strategies that you need to not only live longer, but live better. So hop on over to the show notes, grab that link to the Healthy House Calls with Angel newsletter, and come on and join us in the exciting world of lifestyle medicine. Until next time, be well and be good to yourself. Thank you for tuning in to Healthy House Calls with Angel. I hope today's episode leaves you feeling inspired, motivated, and empowered to live your best life by applying the practical tools of holistic lifestyle medicine to eat, sleep, move, and live better. Please don't forget to subscribe wherever you receive this podcast. Check in for show notes and share this podcast with friends. If you'd like even more tips in your inbox, subscribe to my newsletter, Healthy House Calls with Angel, by using the link in the show description. Until next time, be well and be good to yourself.